Carpal tunnel syndrome is a condition that can leave your fingers feeling numb or swollen and difficult to use. Dr. Stephen Scarangella is board certified in orthopedic surgery and in hand and upper extremity surgery. He is an expert in treating conditions related to the hand, and he works with high-level college and professional athletes. Dr. Scarangella talked to us about carpal tunnel syndrome and how he helps people recover from this condition.
Carpal tunnel syndrome is a condition that occurs when there's a pinched nerve in the palm. The area of the carpal tunnel is from the wrist crease to the palm crease, and in that area there's a ligament that attaches to bone on both sides, a nerve right under the ligament, and the tendons that flex the fingers and the thumb under the nerve. There are 2 tendons to each finger and 1 to the thumb, so there are 9 tendons under the nerve. The tendons are typically the cause of carpal tunnel syndrome. Swelling and inflammation in the tendons causes compression of the nerve against the ligament. The effect on the nerve is as if you were watering your grass with your hose and somebody steps on your hose. No water. Here the nerve is getting stepped on and the blood supply to the nerve is getting stepped on, and that loss of blood supply to the nerve creates the symptoms of carpal tunnel syndrome. Typically the symptoms involve numbness and tingling that can be some of the fingers or all of the fingers. As the condition gets more severe, then you can also develop pain as well, and that pain typically occurs at night and typically will wake you up from sleep. The treatment initially to manage this conservatively is to wear a simple wrist brace at night when you sleep, not during the day but simply at night. It prevents your wrist from flexing, which actually doubles the compression on the nerve and creates the symptoms that wake you from sleep. If symptoms are continuing to progress, there are additional conservative management that can be in the form of a corticosteroid injection occasionally. If you have a carpal tunnel syndrome condition that's not responding to treatment or is more severe, then certainly surgical management can resolve this very predictably as long as it's done in a timely fashion. The surgery typically is done under a local anesthetic, takes approximately 15 minutes to do, involves a simple incision in the palm, and then the ligament itself is released, which allows the pressure to be removed from the nerve and the blood supply to be restored. It can be compared to opening a bridge to let a ship go through. We're just making more room. The aftercare for the surgery is very simple. A big bandage is applied the day of the surgery, but that is converted to a Band-Aid by the next morning. You can use the hand immediately. Just avoid heavy use until the strength of the hand is restored, which is typically in a 4 to 6 week period.
Dr. Scarangella has been an orthopedic surgeon in private practice for nearly 30 years. His specialized experience in hand surgery and his caring bedside manner helped him to get recognized as one of the top docs in Connecticut in 2021. Visit the Hartford Orthopedic Surgeon's website to make an appointment.